Good afternoon, everybody. Thanks very much indeed for joining us and for all of your help actually in getting over to the public important public information and messages at this time. So we're very grateful to colleagues in the media. I'm joined by Sir Richard Leese this afternoon. Both of us have just been at the third meeting of the Greater Manchester COVID Emergency Committee, and we'll begin by giving you an update on the meeting and the issues arising. I'll ask Richard to talk in a moment around NHS preparedness, but also economic issues as well. I will then open the floor to the questions that are coming in, and we'll try and take as many of those as we can. So the first thing I can report today is that Greater Manchester is in a good state of preparedness for obviously a very difficult month that lies ahead. It's just a fortnight since we first held a meeting of the GM COVID Emergency Committee, and I can say that colleagues have moved mountains in that last fortnight to put us in a position where we are organised and ready to face what is coming, both in terms of supporting people within our communities, but also, of course, treating people within the National Health Service and all of the backup systems and support that's needed to do that. So I have to start by just saying a huge thank you to public servants throughout Greater Manchester who've been working flat out this last fortnight in difficult circumstances, but also colleagues in the voluntary and community sector supporting us, as well as the private sector stepping forward and doing great things as well. So it really has been a Greater Manchester team effort in the way that we do best, and I'd like to thank everybody for everything that they're doing at this particular moment in time. In terms of issues arising and some of the updates I can give, the supply of personal protective equipment remains a major concern, although there is some progress to report. We took delivery on Saturday evening of a large shipment of equipment destined for adult social care across Greater Manchester, and we're grateful for the help we had nationally in getting hold of that. But also we have been working hard to procure equipment at our own level, and some success to report there as well. So while there is still a challenging situation with regard to supply of protective equipment, some progress since this press briefing last week. I have to say, a bigger and less resolved issue is testing, and you'll all, of course, will be familiar with the way in which that has gone up to the top of the agenda nationally over the last few days. It's an issue, of course, in terms of stopping the spread of the disease, but also in terms of getting public servants back to work. The Chief Constable reported to the meeting that about 1 in 5 of GMP staff are out of action because of self-isolation. And that's, of course, a major concern, and it's getting that testing capacity into the police service and other public services that will help us get people back to work, and that's a very important concern going forward. What I would want to get over to the government today is that I think Greater Manchester stands ready to help in a national effort to get testing capacity up to the level that is required. I've spoken just before this briefing with Dame Nancy Rothwell, Vice-Chancellor of Manchester University. She's talking to the other universities, and together with the National Health Service in Greater Manchester, of course, very aligned with our universities, we're trying to do all we can to mobilise qualified staff, laboratory space, and indeed chemical reagents to support the national testing effort. And that offer goes out from Greater Manchester to the government. You know, we stand ready to help in any way we can to mobilise that extra support to increase the number of tests. In terms of other updates, just briefly to touch upon, the whole question of schools is an issue that it's felt greater clarity might be needed on. We are, of course, about to head into the school holidays. Most of our 10 boroughs are reporting that our schools are planning to remain open during that period. But there is a call on the government just to clarify arrangements for schools going forward, and particularly during the Easter period. Perhaps there may need to be some consolidation of school sites that are remaining open. That is happening already to a degree, but it was felt it would be helpful to have clarity on the position with regard to schools as we go into the Easter period. Homelessness was a big theme of this meeting last week. I can report now that there are over 500 people in accommodation paid for by the release of the money at last week's meeting. So progress made, although challenges remain, and we are working with our 10 councils to work through those issues. Finally, on this section from me, before I invite Richard to provide his update, just want to say a couple of words about transport issues. Of course, patronage on transport across the country has dropped to low levels, as we saw at the Downing Street press briefing yesterday. On Metrolink, it is now below 10% of normal passenger volumes, and there are many trams travelling during the day that are pretty much empty. So I have to say that from this weekend, a decision has been taken to reduce service levels to a 20-minute interval on Metrolink, and we think that will be necessary for the level of volume that we are dealing with, but also something that we will keep under review, maintaining a service for key workers. I know that there is concern within the bus industry around the pressure on budgets at this particular time. On that, I can report that Transport for Greater Manchester has made arrangements to pay bus companies today a significant part of what they were due for April, having already paid them in full in March. So we are doing everything we can to support our bus companies at this time, although we continue to want a discussion with them around making sure that we are servicing key sites, particularly hospitals, at this particular moment in time, as well, of course, as having an open book approach so that we're certain that that public funds are being properly used. So that's the initial update from me. I'm now going to hand over the floor to Sir Richard Leese, who will provide his update. Richard.
Good, everybody, and thanks for joining us. I'm going to say quite a bit about health, a little bit about the economy before we move to the Q&A. Firstly, a little bit about organisation, how we're organised in Greater Manchester. Health and care services are being coordinated through two of what the NHS describes as cells, a hospital cell, which is what it says on the tin, and an out-of-hospital cell that brings together not just health services, but care and other related services as well. Those sit within a coordination group that brings all of that together, and that is part of the arrangements for the strategic coordination group, which is coordinating all COVID-related services across Greater Manchester. If I start with the hospital part of this and the number of cases we're currently dealing with, the figure as of March the 31st, yesterday, of diagnosed cases in Greater Manchester was 901. We know that is an enormous underestimate of the actual number of cases, partly for the reasons that Andy gave about where we're up to with testing at the moment. Of those 901, that again, as of yesterday, there were 475 of those people in hospital. 94 of those in high dependency units or in intensive care units, and then 381 other cases in hospitals. They are currently taking around about a third of all the beds we have available in hospital. Because we stopped doing elective surgery and we've discharged everybody that can be discharged, we've still got round about 40% of our beds available. So there is room over the next couple of weeks to be able to take more cases into hospital, but we are expecting that space will get filled over that period of time. I have to say, at this time of the year, having 40% of our beds free is absolutely unheard of, and a sterling job has been done in being able to get everybody out of hospital that we possibly could reasonably get out of hospital to make sure that we've got the capacity there. In terms of a little bit more on testing, that now for hospitals beginning to test certainly those staff who are dealing with COVID patients and hospitals now have some capacity to test staff who are at home, who aren't showing any symptoms themselves but are isolating because of who they live with, and should be able to test those, and if those people are free, to be able to get them back to work. There is still an enormous shortage of testing for other health staff, for primary care staff, that includes GPs within that and the GP staff, and for social care staff, and that's a real concern, which I'll touch on slightly before I've concluded. We are expecting a new simpler test to come forwards, but that could be at least 2 weeks before we get that. And in terms of antibody testing, to be able to test whether people have had the virus or not, we're probably still 3 or 4 weeks away from that. The number of cases is increasing quite rapidly now. Over the past week, it has tripled. So we are seeing a very sharp, steep rise, and fairly certain that the capacity that we have got will be taken up. I think that leads me to the proposed field hospital at Manchester Central. It's intended to have that up and running by April the 12th. It will be a step-down hospital, so it will not be for intensive care cases. It's intended to have 500 beds and to serve the whole of the Northwest. And again, that's to try and ensure that the capacity that we do have in our existing hospitals can be maximised for intensive care use and minimised for other users over the period of time we are going to go through, because we are still some weeks away from the peak of cases before we expect it to flatten out. As far as care is concerned, again, as of yesterday, we still do have care spaces available, so we still are able to discharge people from hospital. We've not been able to, not been required to take emergency measures yet. There are issues about willingness of care homes to take people who may have had COVID-19 type symptoms, and again that goes with the problem with the absence of testing, and we do have major issues still in social care, in particular with protective equipment. And I think when we look at the whole equation of here of who's doing what, there is quite rightly a lot of focus on the front line within our hospitals, perhaps less so on social care staff, who are just as important in making sure that we can effectively manage the health and care side of this pandemic. I won't say anything more on the health side. A couple of things on the economy side. First of all, we know that the economy is taking a real hit. We can't wait until the crisis is over before we start planning for the future, and we're already planning to make sure that we can get the support we need in place to get Greater Manchester's economy back on the growth trajectory it was on before this crisis. In terms of businesses remaining open, I think there's a lot of misunderstanding about this, that government has decreed that some businesses have to close. It's not specified which ones would stay open. And certainly we want to take the position for any business that if it can stay open safely, and that includes the working conditions for its staff and for its customers to be safe, then we would support them staying open. We also say that if employees have concerns about whether they're being required to work in unsafe conditions, that they should contact their district council, their local council COVID-19 number. They've all got one, they've all got them on their websites, and report that, because we clearly would want to follow that up. One final thing, and this relates to the support that government is providing to both business and employees, and there is no doubt that it has been ramped up over the past couple of weeks, although I think there are still gaps. One of those gaps is for people who are full-time employees who have been put on to part-time hours, so they're still able and required to work, but they can be worse off than full-time workers who've effectively been laid off, who've been furloughed, because if they're on part-time work, they're not entitled to the 80% that full-time workers who are furloughed get. So a gap there that I hope that government, who clearly are listening because of what they have done, will listen and fill that gap. I'll finish there and obviously field any questions that get directed at me. Thank you.
Thanks very much indeed, Richard. If I could just pick up that theme that you ended on in terms of gaps, we were very prominent in calling for more support for self-employed people, and it was good that the government responded to that call last week with its package, although have been contacted by many more recently self-employed people in the last week, and it would appear there is still a gap for those who've become self-employed in the last year. Many of those are younger people, often in rented accommodation, and we feel that is still something that the government needs to address, because there's a great sense of unfairness at the moment that while lots of other employees have been looked after and people who are self-employed have been looked after, this group has been neglected to date. So we've developed a proposal at the Greater Manchester Combined Authority, which we think addresses the government's concerns around a solution in this group, and that would be to allow their 2019-2020 tax return now to be submitted in the same way that the government allowed late submission of the 2018-19 tax returns. We don't see there's any difference in terms of establishing people's earnings, and we think this would be the fair thing to do, particularly for this group. So I'll today be writing to the Chancellor to put this proposal to him, which I believe would give those people who are currently missing out a fair solution in line with other self-employed people. And the advice I've received suggests that there is no difference there in terms of risks of fraud from the other self-employed groups. On workplaces, Richard is absolutely right that if workplaces can work safely, then there shouldn't be a concern, although I have received many complaints in the last week of individuals who say they feel at risk at work and are worried about what they're then bringing back home, particularly if they're living with vulnerable family members. So there is a widespread concern. There is a group at Greater Manchester level looking at this across the 10 districts, led by the Community Safety and Trading Standards Leeds, but also supported by Greater Manchester Police. Our message would be, you know, companies do have to act responsibly and put the health of their employees first. If they can't observe safe distancing, if they can't provide hand washing facilities or sanitizer, then really they shouldn't be open because of the health concern. But also there's a concern here around the guidance that companies are receiving, and there's a lot of confusion, not of their making. The Public Health England guidance currently says that safe distancing should be observed where possible. My concern is the words "where possible" is something of a get out clause for those who may not want to follow the guidance. So together with the Mayor of the Liverpool City region, I'll be writing to the Business Secretary and the Health Secretary to ask that this ambiguity in the guidance is removed so that everybody knows where they stand. Finally, there's only a minority of businesses who are not doing the right thing. The vast majority are working hard to look after their employees and, of course, contribute to the wider community effort. And today on the Greater Manchester Combined Authority website, we'll be putting up some videos from across Greater Manchester of companies who are turning their facilities and their production to support the wider Greater Manchester effort. And we want to celebrate what they're doing as part of a cross-community campaign to support our communities at this challenging time. So that's enough from me in terms of the update at the beginning. I'll now, Ross, open the floor to any questions that colleagues have.
Fantastic, thank you, Andy. I'm going to start with a question from Jonathan Bunn at LGC, who's talking about the social care system. This may be one that Richard wants to maybe pick up first. When do we expect councils to take up the flexibilities on the Care Act duties introduced by the government. There's also a couple of questions here about the field hospital, which Richard, I'm not sure if you would be able to expand on. There's a question from Josh Halliday about when is it likely to open and what capacity. I think some of that you've covered already, but if there's anything there you want to expand on. And then is the council looking at other venues for the hospitals? Again, something you've touched on, but if you could expand on there. So Jonathan Bunn, Josh Halliday and Dan Whelan, they're the first three questions.
Okay, thanks for that, Ross. First, in terms of the social care system, I think as I indicated in the presentation that we still have capacity within the system at the moment, and clearly whilst we've got capacity to effectively for people who've got care needs to be able to provide a normal service, so we'll continue to do that. It's impossible to predict how long that will continue because clearly it will depend on the rate of increase in the number of cases, and although we have rough estimates of that, there is no certainty about that. As far as the underfunding of social care is concerned, that means we do start off with probably less resource than we would like to, but we are not restricting spending at the moment, and government has said to us that spend what you need to spend in order to provide health and care services, and that's what we're doing, with a belief that at some point we will get that back. But the situation we're in, we're not going to curb spending if we need to spend in order to make sure people get proper care. On the field hospital, it's expected to open on April the 12th, so end of next week. It is planned to have 500 beds within that hospital. It's going to be the chief executive and senior management team have been appointed, and they are busy staffing up now in order to be able to open at the end of next week. I think that covers the points, Ross. Yeah,
thank you very much. I'm going to take Andy Bounds and Kevin Fitzpatrick. So one for you, Richard. If you might not know this off the top of your head, but what is the rate of absenteeism amongst NHS and social care employees, if we've got any indication on that? And then Andy, for you after that, Kevin Fitzpatrick is asking about have people rough sleeping in Greater Manchester now been accommodated? And do we anticipate everyone will be accommodated? And also it's picking up the point about bus companies, which I think you've addressed, but if you could just reiterate the point about they were saying that TFGM is withholding money and they won't agree to living conditions.
This is to a certain extent off the top of my head, and it does fluctuate from time to time, but we had figures earlier today across public services, and we're probably looking at absence rates, a mixture of self-isolation and people with symptoms in the region of 15 to 20%. But I say that can go up and down on any given day. Expectation, if anything, is that it's going to get worse rather than better before we see any long-term improvement.
Thanks, Ross, and thanks, Kevin, for your question. I think if I can see it here, it says, have all people been offered a room? My understanding is yes, but we're just now trying to match people to accommodation. And as I say, over 500 have already been accommodated, which represents a phenomenal effort on behalf of Manchester City Council's homelessness team, but also all the other 9 districts, the voluntary organisations that work with them, because it isn't just about placing somebody, it's then also having the support package that comes with that placement. So I hope you can appreciate this is a huge amount of effort. Further capacity is coming on stream in the next few days. So as we get through the rest of this week, I would anticipate that we'll soon be in a position where everyone will be in accommodation. Obviously, it's a challenging process. But you know, the work that's being done is huge. There are issues still to work out, but we're working hard on all of those. In terms of the bus company issue, I think it's reasonable for us to say that at this particular moment in time, we need to have bus services that go to the critical sites, particularly hospitals, as I said, but obviously also essential workplaces, for instance, that are still open. So we have to have a discussion with the bus companies rather than just them say they, give us the money and that's it. I'm afraid it can't be like that. And of course, we've got a wider transport system to look after rather than just buses. So while the railways have been offered funding, that isn't true yet of the Metrolink system. So Greater Manchester has a lot of liabilities with regard to Metrolink, which has seen a massive fall in its revenue. So we need to have an eye to the whole of the transport system. So we have paid bus companies today. We want to continue to have a discussion with them about services to key sites. We think support should be provided on an open book basis. And of course, we need to continue to have an eye to the wider Greater Manchester transport system and its financial sustainability. And hence, that's why we remain in discussions with the bus companies. But we paid them for March, we paid them early in April as a sign of goodwill. And we don't want to see any bus company hitting difficulties or ceasing to operate at this time. We're just trying to do so while managing a very complex transport picture.
Thanks, Andy. I'm just going to pick up a question here. Just
Richard,
yeah, I just want to come back. I can now see the questions on my screen. Just one or two there, but on the field hospital, as far as I'm aware, we're not looking for additional sites at the moment. There is comparison made with London. I think the London Field Hospital is a different sort of hospital, and it is dealing with a much larger population as well. So at the moment, we are not looking for an alternative. I see that Andy Barron's question uses the term absenteeism. Absenteeism normally implies people are absent that should be at work, and I think I have to make it absolutely clear is that certainly anybody who's remotely got COVID-19 symptoms, we do not want coming to work in the health and social care system or anywhere else really. But there is an absolute commitment from staff who are able to provide support to be able to provide that support. And I just really want to make that very, very clear indeed. Yeah, okay.
Fantastic. I've just got one question, Andy, for you from Niall Griffiths. Have you had any more information or guidance from the government about helping GM residents stranded abroad?
Thanks, Niall. Obviously, we had a statement from the Foreign Secretary on Monday, which answered some of our questions around the support that we needed, but not necessarily all, because it's a very complex situation. We have Greater Manchester residents in a whole number of countries. The latest figures that I have tell me that almost 200 cases of Greater Manchester residents stranded overseas have come to our attention, and we're working both with the Foreign Office and with embassies and high commissions in the countries affected. So we've been working hard to bring people home. Some people are coming home, but it remains a very challenging situation that is different country by country. But there are still a high number of Greater Manchester residents stranded, and we are continuing to provide them with whatever support that we can.
Thanks. I'm just Richard, these two are probably best directed at you. One from Jen Williams at the MEN. There's been a widely publicised recruitment drive for thousands of nurses for hospitals like the Nightingale in London. Many are likely to be from this region. Given that we are also likely to see a considerable increase in the coming weeks, are we confident that we can staff our own surge, including at the GMEX? And just additionally, below that, there's a question from Pat Hurst at PA. Again, you might not have the number there, but it's a question about how many ventilators are available or anticipated.
Okay, in terms of the first question, clearly that in order to staff adequately all the NHS facilities we're going to need over the coming months, that there are lots and lots of people who've left the service who are coming back in, doctors, nurses, ancillary staff, and our ability to staff up these additional facilities depends on the success that we're having there. All the indications so far are that we've been very successful in getting more people to come back into the health and care services, and if that continues, that we should be able to adequately staff the facility we're putting in place at Manchester Central. And clearly what we don't want to be doing is competing with other parts of the country. There are likely to be similar hospitals in Leeds and Birmingham as well, and what we'll have to rely on is for NHS England in particular to make sure that they are allocating the resources that are available to them in a fair and a proper way that best meets health needs. And clearly that's something that we will be monitoring through the strategic coordination group in Greater Manchester. I see the question about ventilators. I don't know how many ventilators we've got. I know we're not using them all at the moment, and I also know that of the 475 people who are in hospital with COVID-19, only 31 of those require mechanical ventilation at the moment. So being in hospital, even being in intensive care, does not necessarily require mechanical ventilation. Indeed, only about a third of them are using oxygen at the moment. So we certainly haven't reached the breakdown point yet, but I really can't tell you how far we are off that.
Thanks, Rich. I'm just going to come to Dan Whelan's question about construction sites and pass that over to Andy.
Thanks, Ross, and thanks, Dan, for your question. Of course, construction sites would be considered essential in terms of the facilities they're building. Obviously, construction of the Nightingale North Hospital at Manchester Central, but there are other capacity being built around the region that will be considered essential. But obviously, there's other sites that would not be considered essential, and there is a concern that obviously some construction practices in terms of how many people are required to carry out certain procedures around driving piles or other things mean that you can't observe safe distancing. So there is a potential conflict here between the safe distancing requirement and health and safety rules. So this is a major concern, and as I said before, lots of members of the public have been in touch about it. I think, as Richard said earlier, you know, if things can be done safely and that can be demonstrated, then that is clear that the government has said that people can stay open. But we receive a number of reports that this is not the case. And the point I would want to reiterate is, at this particular moment in time, an unprecedented global health pandemic in our lifetimes, health has got to come first. And if people can't ensure people's health and safety at work, then really the right thing is to close. And the quicker we deal with this and stop the spread of this virus, of course, the quicker the economy will bounce back. So it's a message to all employers to say, you know, please put the health and safety of your employees first. And if you can't guarantee it, then do the responsible thing, as other building companies have done, and close so that we can protect the public and bounce back as early as possible.
Thanks, Andy. I'm going to take one from Claire Fallon. It's directed at Sir Richard. There was mention of now having the capacity to test some NHS staff at home who've been in isolation. Claire's asking, is this a diagnostic test as opposed to an antigen test? And how many so far have been tested? How many are we aiming to do each day or week? And how many staff will be able to go back to work? I'm not sure if there's something that's been dealt with at a DM level or not.
I certainly can't give most of the numbers. I'd say it is a diagnostic test, not an antibody test. And I think, as said in the presentation, we're still several weeks away from having the antibody test available at all, never mind widely available. I think, as Andy set out very clearly, I added a little bit to it, is that we don't yet have anywhere near enough testing capacity. That's why we're working with universities and others to try and increase the testing capacity. We're not yet testing all staff in hospitals, never mind those outside. Hospitals are being given a 15% increase in capacity to test employees at home. So it is a diagnostic test. They've only had that facility since Monday of this week, so it's far too early to say how many people have been tested. The ambition is clearly to get enough testing facility in place that we can test everybody, because we do know from what's happening in other countries that testing is absolutely the key to being able to bring this thing under control.
I'm just going to skip to a question from Richard Marston at the Daily Mail. Richard, where you're there, what is the current trend in new daily cases confirmed within Greater Manchester? And he's asking, is there any evidence yet of a flattening of the upward curve?
Total number of cases has tripled over the past 7 days. So that's and the rate of increase has been on the up over the last week. It would appear from the curve it's not currently getting any steeper, but it's a pretty steep curve. We're not really expecting any flattening for a couple of weeks, because the earliest we anticipate the benefits from the lockdown will be in about 2 weeks' time, because clearly we've now got cases that really people who've contracted the virus before we went into lockdown. So that's what's happening at the moment. The expectation is in around about 2 weeks time, the curve should start to flatten off at that point.
Okay, I'm going to take a question here from Tom Dambach at Hits Radio. It's in 2 parts. The first part's for Andy. Would be, we've heard that many small businesses risk closing for good as a result of this crisis. What support is or can be offered to those struggling? And then the second part is for Sir Richard, which asks about what the current plans are for offering any council tax breaks to some households. So Andy, if you take your part first.
Thanks, Tom. So we have pretty much, I think now across all 10 districts, stood up the small grant support scheme. So that's a £10,000 grant to small businesses, particularly who might struggle to access other government support. So that's been stood up over the last week, and hopefully that will be getting support to those small businesses, Tom, that you mentioned. Later today, with the Greater Manchester LEP, I'm chairing a session for businesses across Greater Manchester where we can hear some of their concerns, and so we are keeping in close touch with the business community. But you know, we're beginning to get support out to them, but we recognise how hard it is for them at this time. Ross, if I could just say something extra on testing, if that's okay, just because I think Richard put it very well. You know, the issue is central to this situation now, and I just want to repeat what I was saying just to get this over. I think we do need a national effort. The call needs to go out to industry to see if the chemical reagents are held in various places. We need to unlock all of the capacity within our labs across our university system. We need clarity from the government about whether there'll be a major testing site here, in the same way that we've seen decisions to locate one in the south. So I think what we need to do is open up this whole issue of testing. And you know, we need, if the government were to make a clear ask of us, then we would quickly respond to that, both in terms of qualified staff, lab space, chemicals. And I think we need to approach this issue in that way from here, because we rapidly need to expand the testing. And this is a constructive offer from Greater Manchester to the government, and we will put our attention and focus behind sourcing extra support so that we can stand up an expanded testing capacity in the shortest possible space of time.
Thank you. I'm just going to take one from Niall Griffiths, and then after that one I'm going to move on to there's a number of questions in about policing. Niall's question first.
You didn't do the second half of Tom's, by the way.
Sorry, Richard. My bad.
Yeah.
You need to put me on. Am I on? I'm not on. I haven't got a red thing around me anyway. Oh, now I am. Thank you. Okay. In terms of council tax rates, and that all councils have been provided with some hardship funding by government. The majority of that will go into payments that go to everybody who's in receipt of council tax or current council tax support schemes, which is a payment of £150 to all of those households. Certainly Manchester were offering that to some other households as well where we think that they're going into that category as a result of COVID-19. On top of that, we have a hardship fund which is available for any household that gets into problems, financial problems with the council tax. That's on a discretionary basis, and it will be up for people to contact the council if they are in that position. That's
fantastic. I'll just go back to that question from Niall, which I think the one that Andy will pick up. He's asking, have we encountered any more resistance from hotels taking on homeless people? He's asking, are there any concerns about having security on site to reduce potential incidents between those staying in the same place, or are people being spaced apart in different hotels?
Thanks, Niall. No, I'm pleased to say we've not seen a repeat of the issues we had with Britannia hotels, which we reported to you last week. We've got a good cooperation from a number of organisations, although the issues are challenging, and particularly the issue of both security and staffing and wider support. So I think it's important to say that this is a huge undertaking that we set in train this time last week. And it was always going to present challenges, and it has done. But having said that, we've already moved a considerable distance in accommodating 500 people. More to do, and definitely more to do to put security on site alongside qualified professionals to provide drug and alcohol support and other support services. We've mobilised a fundraising campaign through the Greater Manchester Mayor's charity for both dry food goods, but also personal hygiene products to support people, as well as the appeal for IT equipment, because everybody at this time needs to be able to access government support and have contact with the outside world. So that appeal has gone out through the Greater Manchester Mayor's charity to businesses and individuals across Greater Manchester. You know, we've stood this system up, but we now need to sort of improve it as we go forward from here. But I'm very, very proud of what people have done. And I think one of the things that may come from this whole situation is a positive legacy around homelessness. It feels to me that if we can stand up a system of this kind in difficult times, then why can't we do it when times are easier? And certainly I would like to see this being a legacy that comes from this, which is a positive one.
Thank you. So I'm just going to move to, there's three questions here on the policing situation. So Jen Williams' question, please could we get an update on the policing situation? Have we continued to see a lot of call outs to large gatherings, or has that dropped since Deputy Mayor Bev Hughes gave her update last week? And then just on the point about 1 in 5 GMP staff being currently out of action or self-isolating, Hannah and Josh are both asking what impact is that having on the force's ability to operate effectively?
Thanks, Ross. So that was the figure which the Chief Constable gave to the meeting this morning, and that relates more to frontline staff. What we have found is that where staff are working indoors, particularly in the call centres, some of the absenteeism is the wrong word, isn't it? Some of the rate at which people have had to self-isolate is even higher. So it is creating a real pressure on Greater Manchester Police. We have a large number of the antibody tests on order, which we're hoping to have within the possession of Greater Manchester Police by the middle of April. And that's, of course, the test that allows people to know whether or not they've had coronavirus. So, you know, once those tests are in our possession, we'll hopefully be able to help get some of those people back to work. In terms of the effect that that's having, of course, it is having an effect on the way in which we can investigate all levels of crime and reports that are coming in. So it is a concern, but we are trying to maintain as proactive as possible an approach to dealing with all of the situations that the police are currently having to deal with. It's a very complex situation. In terms of the large gatherings that Jen mentions in her question, I think the Chief Constable has said in the last couple of days that we've seen a noticeable fall in the number of gatherings, and particularly in licensed premises, after hours or lock-ins. We've seen much less of that happening, although there is still reports, and they're being dealt with. One of the messages which our public health colleagues wanted to get over today was the message to young people that they aren't immune from this. And of course, we'll all have seen in the news over the last 48 hours the really tragic death of a 19-year-old and I believe a 13-year-old from COVID-19. We believe more needs to be done from the national level to get the message over to young people that they are not immune from this. They too could have a serious illness or indeed or die from this condition. And it doesn't mean that somebody has to have underlying conditions, as we've seen. There have been cases where that's not the case. So we feel there is a need for more direct messaging to younger people. You know, if they think they're invincible, they're not. And if they're going out in breach of the government's guidelines, they may be putting other people at risk. We believe that that message now needs to be reinforced as we go into the more difficult part of this crisis.
Thanks very much. I'm just going to go to a question from Claire Fallon, and then there's another couple, and then I think we're done. Claire Fallon's asked about PPE. And you said at the start there were significant problems with PPE. Frontline hospital staff and social care staff are still saying there's not enough. That they're not working with, they're working without the right level of PPE. Government has said there's enough stock, but what have we been told in Greater Manchester are the reasons there's been a delay to getting PPE? I think, Andy, if you want to take that first, and Richard may want to come in on that one as well. Yeah.
So it's true, Claire. I mean, there's been a bit of progress, but significant challenges remain in hospitals, but particularly I would say in primary care and social care. There's been a lack of flow of equipment, particularly into primary and social care. So Richard was right to say that, you know, the social care workforce often forgotten, but really does need that equipment. We worked quite hard to get a delivery of 42 pallets of equipment on Saturday. And one of the things we discussed on our call today was making sure that that now becomes a repeat delivery. That came from the national stockpile. I have to say it was difficult to get it. It took a lot of negotiation. So I don't know all of the reasons, but it would still seem there are problems in getting a regular flow of this equipment from the national stockpile. The message we get is most have got some that they can use for now, but there will be a problem quite soon unless there are more deliveries. So outside of that, we are working hard to try and identify suppliers of protective equipment on our own initiative, and we've been successful in sourcing further material to support the national stockpile. So the situation has eased a little from the report we gave you last week, but it wouldn't appear to me yet that there are regular, understood, clear arrangements for the delivery of protective equipment to the acute NHS, primary care and social care. And these arrangements need to bed down further still, alongside our local efforts to supplement it.
I just add a few things to that. We did have, I think, the first significant delivery, as Andy said, over the weekend, and this, I think Andy said 42 pallets. That we had that's about 3 to 4 days supply of protective equipment. That will last us till Friday, when we are expecting another delivery, and we're expecting to have a new national system operating from next Monday, which will be through military deliveries. If the stock's available, there clearly are problems with the logistics, because it's not been getting out. That was over the weekend the first significant delivery that we've had, and we are all busy through any means we can trying to find alternative supplies to augment what is coming through from the national stock. So we've not got enough for all hospital staff at the moment, certainly not enough for care staff, primary care staff. That is not a satisfactory position at all.
So I'm just going to do a last 2 questions, and then Andy, I think you're going to sum up just at the end. Richard, well, you're just there. Pat Hurst just wants clarification that there are no other plans to set up additional site, save for the GMEX to increase bed capacity. And then the final question is from Dan Whelan at Place Northwest, who's put it to Andy, but I think, Richard, you might want to address this one as well. What is your message to local authorities unsure how to approach ongoing or future development in their areas? Should they push on and continue to engage with the private sector, or hang fire?
Shall I start as I'm on, then Andy can finish off altogether. Be very careful with this one, Pat. It says there are no other plans. There are no other plans that I'm aware of. So, and certainly we're not looking for anywhere else at the moment. Clearly, this is a situation that will be kept under review all the time. But at the moment, we're not looking for anything additional to the Manchester Central site. For Dan's question, relates partly to something I said right at the beginning, is that clearly our economy is taking a hit. We need to try and make sure that we keep as much of our economy going as possible, and as we come out of this crisis, that we're able to get things underway as quickly as possible. And so for all of the local authorities in Greater Manchester, and to the extent that they've got capacity that's not been diverted to COVID-19, that we'd urge all of them to be doing what they can to make sure they're ready for liftoff when we're able to return to something that's anything like normal. That's it from me.
Thanks, Richard. And just say thanks to all colleagues in the media for your questions, and as I say again, for everything that you're doing to just get this information out to the public. We really appreciate you joining us this afternoon. Just to finish off with a few thoughts. As we go forward, I think we do need to think about economic recovery, as Richard is saying. So just to pick up on your question, Dan, it's clearly not necessarily for now, because we are about to hit the most difficult period of this. But our attention will turn at some point to economic recovery and the fiscal stimulus that I believe will be needed from the government, and we need to start thinking about that. So that we can bounce back as quickly as possible. But it's not quite for now. But we'll begin to turn our attention in that direction before too long. In terms of where my thinking is, and just to sort of put some issues that I think are coming down the track, so that we could maybe pick these up next week on the briefing or the week after. I think I think we're probably all experiencing this as we live this new reality that we're in. The effects of isolation on people, particularly older people, are going to become more and more significant the further we get into this, and particularly if you combine that with news that is getting more and more difficult for people to listen to. I think we have to have an eye to that. So one of the issues we've discussed today with the leaders and the NHS and GMP is whether or not we can have more 24/7 support. That's not to replicate the phone numbers that are already out there, but whether or not we can provide a facility that through the local numbers people can always get somebody on the phone whatever time of the day or night. We think that might be helpful to people who might be struggling with this situation. So we are looking at how we can do that. And Richard is working with health colleagues on more specialist mental health support that could be mobilised at this time. So we've got work underway in those areas, and just to sort of put it on your agenda that this is something that we may well be coming back to next week or in due course. I mentioned the videos that we're putting up, so please look out for those. There've been Greater Manchester companies stepping forward to do all kinds of things in the last week to support the effort, and we're extremely grateful to them. The Co-op group have supplied a whole kind of huge range of stuff to support our work on homelessness, so products to support people in hotels, and we're really grateful to them. And you'll see more announcements in the coming days about more companies that are stepping forward to help us. So that's really appreciated. And just to finish on a slightly more positive note, our nighttime economy advisor, Sasha Lord, has been working with his counterpart in Berlin to bring a service from Berlin to Manchester called United We Stream, which is a platform for Greater Manchester musicians, talent, artists, to make sure that they can still access their audience at this difficult time and hopefully give everybody a lift. So I'm just putting you all on notice that it launches on Friday night, so maybe that's something to look out for. It's going to work most nights over the weekends. Huge range of exciting stuff coming, and we think that might give people a lift. But the money that it raises will go to support those nighttime economy venues that are struggling. It will be funding raised for the Greater Manchester Mayor's charity alongside other good causes. So it's a fantastic initiative, and we'll certainly be encouraging everybody in Greater Manchester to get behind it. So that's it, Ross. I think we've covered all the questions and we've covered all of the ground that we needed to. Thank you very much, everybody. Stay safe. Thank you for everything that you're doing, both in your work and what you're doing in your community. We're in a good state of readiness, as I said at the very beginning. And that's not just because of the work of our public services, but the way our communities have rallied round. So we are going to face a really tough month. There's no doubt about that. But as ever, Greater Manchester's strength and spirit will come through. Thanks, everyone.